Welcome to 12 to Your Health. I'm Dr. Derek Da Silva. Well, golf season is in full swing, and hitting a few rounds may just be the ticket to relieving stress and helping maintain a healthy lifestyle. But the wrong posture and technique can put you in harm's way. Luckily, Dr. Dante Implicito is here to explain the risks and the right way to tee off. He's an orthopedic spine surgeon in Glen Rock. Thanks so much for joining us.
Thanks for having me.
So you're a golfer?
I am indeed.
So have you implemented these techniques into your swing?
I have, yes.
Is it working?
It is. Well, can always play more.
Yeah, exactly. We can always definitely play more. So what are some of the typical injuries that you see when people don't have the right swing?
Well, in my practice, of course, I see spine injuries. So I see especially low back injuries from golf, but you can have injuries in many of the musculoskeletal systems. In particular, shoulder problems are quite common, as are wrist and upper extremity issues as well.
Well, I mean, I'm afraid to ask you this question because it seems a little redundant, but why the spine?
Well, the swing is designed to change the forces you get from rotating your body through the ball and delivering the force to the ball to drive it down the fairway. And that transition of torque really puts a tremendous amount of stress on your low back.
One of the biggest things, I used to play a lot of golf. I play a lot of tennis right now, but I play, a fair amount of golf. I think one of the biggest things that we see in most sports, amateurs, is that they try to force everything.
That's right.
I mean, and I remember the pros that I've taken lessons from, and they say, don't force it. Let the club do the work.
That's the hardest thing to do. We all grew up playing Little League and standing there at 6 years old when we could barely hold the bat up and swinging as hard as we could. Golf's very, very different. You need to be balanced. You need to take the club back easy and follow through without spinning out and trying to go farther than you actually can.
Right, and when you watch the Masters and the US Open and some of the golf tournaments out there, it looks so effortless. And is it because is it all mechanics?
Yeah, it's perfect mechanics. Perfect mechanics. If you actually put a speed gun, their club speed is 20, 30, 40 miles an hour faster than ours, and it looks like they're not doing anything.
Yeah, that is just absolutely amazing. Just a quick tip on what you think people really need to do to prevent these injuries, very fast.
The first thing to do is get a professional lesson because a good golf instructor will teach you about balance and flexibility and really minimize the amount of injury you'll actually have.
Great. Thank you so much for joining us.
Thanks for having me.
And folks, here's what we're working on for next week. And remember, you can catch 12 to Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m. Well, it's time now for your Health Bite of the Week. Do you want a brighter smile? Well, who doesn't? Well, it's possible with some common household items. You can mix 1 teaspoon of hydrogen peroxide and 1 teaspoon of baking soda. Then add a little bit of water to create a paste. If you use this a couple of times a week instead of toothpaste, you'll probably see those pearly whites shine just a little bit more. And once again, I've got the answer to some common health questions. This is a good one. A lot of people ask me this. How often should I get my vision checked? Well, if you have diabetes, the vision checks become extremely important. Do it regularly, at least once a year. And if you have any health questions you'd like to ask me, email them to me at 12toyourhealth@news12.com. Thanks once again for joining us here today, and here's a look at this week's Community Health Calendar.